Thank you very much, Mr. Chairman. I'd like to speak in favor of the amendment, and also I was a little, I think, alarmed by something my colleague from New Jersey said, and asked him to think about responding. I'm hoping later today, or actually tomorrow, to offer an amendment, sometime tomorrow or tomorrow evening, to offer an amendment to this bill to clarify that one of the fastest growing aspects of health insurance in the United States, consumer-directed health insurance, individual savings accounts, would be allowed to continue. It's not clear, experts tell me, who've looked at the language of the bill that's before us. And you indicated some might and some not if they met some actuarial criteria, which may be hard to determine if they're consumer-directed and if the individual is making decisions as to how the money is spent within that account for a good part of it. And that may be kind of the problem. The number of people under that has gone from 6 million to 8 million in just the last year. In my own district, a Democratic member of the Wisconsin Assembly, who also happens to be the county executive, one of the largest counties in my district, Manitowoc County, successfully negotiated individual savings account health plans for the employees of that county. And it's resulted in enormous savings for the individual employees, $6,000 a year for the county taxpayers, and the endorsement or support of the union representative. And they're concerned that this sort of thing could come to a crashing end. So I don't need to respond now, but I would hope if you have a chance to look at the amendment I'm going to be offering, if there's some way to...
Well, if the gentleman would yield, I would certainly very much enjoy seeing his amendment. The bill says that a plan that has the actuarial value 70% of the federal employee's health plan, which is a number you can adduce by really applying it to any model, would qualify. So I think the gentleman's concern is well founded. I believe the bill addresses it, but we'd certainly want to see what his amendment says.
Well, I thank you. I think there is need for clarification in that area. And
will the gentleman yield?
Yes.
I appreciate that, because this is the second or third time that the gentleman from New Jersey has talked about this 70% actuarial equivalence. And where that appears in the bill is on page 30 under minimum actuarial value, and that relates to the cost sharing. It doesn't relate to the bill itself and what is in the benefits package. That relates to the cost sharing. It says the cost sharing under the essential benefits package shall be designed to provide a level of coverage that is designed to provide benefits that are actuarially equivalent to approximately 70% of the full actuarial value of the benefits provided under the reference benefits package. That doesn't say that any plan, I don't believe it says, and that's why I think that the gentleman has a very valid point. That doesn't say that any plan that has 70% actuarial equivalence to a minimum benefits package is eligible to be covered. And I thank my friend.
Yeah, that's right. And while I have the floor, I just there was some reference to an analysis of this bill before us by the Mayo Clinic, which is a huge employer of good doctors. People come from all over the world to the Mayo Clinic. Marshville Clinic in Dave Obie's district in my state started on a kind of a socialist cooperative basis. All the doctors received the same amount. They wanted to provide the best. They're all in here saying that the structure of the plan, which relies on the Medicare reimbursement rate, is not as good as the private insurance marketplace in terms of reimbursement, and this needs to be fixed. I know everyone's trashing the insurance companies, but they're pretty good at trying to lower the costs that they have in terms of health care and passing some of it on to the premium holders, hopefully. And Medicare doesn't seem to have the same incentive. It's been driven by politics for years, and the disbursements on a geographic basis have become embarrassment here in this country, and I hope that can be fixed. I yield back.